It is probably one of the most effective diets for weight loss for the people who are overweight. Hi, it's Dr. Alan Lifton from Brain-Splained. I'm going to try to answer what's the best diet. That was the question. Super complicated question. I will talk about what diets I use. I'll talk about differences in medication effects and why that seems to happen, and individual variability, the basic idea behind neuropharmacology and biochemistry, and maybe that'll help. One of the diets I use, and I think that's the most controversial, intriguing, and oddball thing I do, is that I ask my patients to take a diet that is mostly pastries, cookies, candy, ice cream, and almost or nothing else, or entirely nothing else. That's a diet I use rarely, but I use it in people who have brain disorders that cause them to not eat. So both the Alzheimer's patients and the Parkinson's patients stop eating. Their brain is telling them not to eat enough, and they take very, very little amount of food. The total daily volume of intake is too small, and they are total calorie deficient. In other words, they're starving. You put food in front of them, and they don't eat it, or at least they eat only very little. When I started practice a long time ago, it was still relatively common for Alzheimer's patients to end up with a feeding tube because they were starving to death, and we need to stop starvation. But that doesn't really get done anymore, and all I can do is either watch their BMI go down, their weight go down, and pretty soon it affects their proteins, their what's called albumin and prealbumin. And when those start to go down, that means they're getting immune suppressed, and they're going to start having a lot of infections, and they'll end up, dying soon. So if we want to keep them from that, I need more calories. And this is the best, easiest way to create the greatest amount of obesity. In these people, that's not possible, but weight gain with the smallest amount of food. I recommend that diet for no one else. So for everybody else, I mostly recommend that those are the foods you need to avoid as much as possible, precisely for the reason I use them. If there's a patient who comes in who has significant metabolic disorder with insulin resistance, like for example the people with polycystic ovary disease, I'll tell them they almost certainly have to be on a keto diet if they can tolerate it, because they have, tremendous insulin resistance. Anyone with metabolic syndrome and insulin resistance might benefit from that diet. Might not, but might, because it's so easy for them to gain weight with excess amounts of insulin. Insulin is a hormone that drives storage of fat. We know that the Mediterranean diet has been proven in a prospective trial to reduce the incidence of Alzheimer's by 50%, comparing the highest to the lowest quartile in people between the age of 30 and 60. So anyone who's at risk of Alzheimer's, or anyone who's walking around who's afraid they'll get Alzheimer's, should be on that diet. I don't mind, but rarely do I actually recommend the whole food plant-based diet. Both the Mediterranean diet and the whole food plant-based diet were shown to reverse atherosclerotic disease and improve the diameter, the opening of blood vessels with angiograms. And they're probably both roughly equally effective at doing that, or providing us with vascular health. And any diet can be manipulated favorably or unfavorably. You can be on a keto diet and you can eat nothing but bacon. But bacon is a known carcinogen, so that doesn't seem very clever. Regardless of the saturated fat and the lipids debate, and the fact that some people, their lipids won't actually be adversely affected if you measure it, although most of the time they are. And you can be on a vegan diet and eat nothing but Oreo cookies, and obviously that's not very healthy. And I don't think that all these highly processed chemical experiments that are plant-based, ready-to-eat foods that are microwavable are necessarily healthy items either, at least not compared to whole foods. But anyway, those are all diets I use. When you treat people with medication, you get different results. You don't get the same result with every patient every time, and this is what makes things complicated. So gabapentin, for example, that's a drug we use mostly for nerve pain. It's an anti-epileptic. It's also used as a mood stabilizer. That drug is soporific. It makes you tired, and the dose-limiting effect is it makes people too drowsy. I can't take that dose. I tried to increase the dose. I couldn't take it. It made me fall asleep. I was asleep all day. That's what you get. Every once in a while, and I don't know the number, but it's less than 1 per 100. Every once in a while you get somebody who takes one pill, and they come back and they say, I took one pill, I couldn't take any more. It made me hyper. I had insomnia all night. So they had opposite effect. And that also happens with benzodiazepams. Sometimes in the hospital you go to a consult for someone who's absolutely bananas, and the nurses kept giving them one of the benzodiazepams. Those are the drugs like Valium and Xanax and Ativan. And the patients get more and more agitated. It's called paradoxical agitation, and that happens with some brains. With recreational drug cannabis, it's fairly famous. There's people who get really paranoid when they take that drug, even though the vast majority of people find that it makes them feel more relaxed. Lamotrigine, which is another anti-seizure medicine, also has the side effect of both insomnia and sedation. Depends on the brain. So not the same response to the same medication in every brain, and that's because we have individual variability. When I ask people for exercise, they say, well, what is the best exercise? What exercise should I be on? And I have that same issue. I'm like, I don't know your brain. You take one brain, and here where I live, it's not exercise, but whatever. I mean, you put one brain on a golf course, and they're happier than they've ever been, and they know that this is what they need to do with their entire life. They're going to put their house on the golf course. You put another brain on the golf course and they're like, this is torture. Why are you doing this to me? And it's the same for bike riding and for swimming and for going to calisthenics classes at the YMCA. Everything is like that because the brains are all different. So they have a different response. And that applies to medications, and it applies to exercise, and it applies to food. So when you put somebody on a diet, you've got to be careful to monitor the response. The individual response is really important. Having said that, there's a withdrawal effect from going off of, if you're on very high doses of refined carbohydrates, you get sugar addiction. And when you go off of that, that's tough. That's a separate problem. That's not actually your brain response to it, to those highly toxic foods. Some of the people, when you put them on a keto diet, which has a very low carbohydrate content, maybe 20 grams a day or less of total carbohydrates, you might be lowering their serotonin levels, and you might run into changes with personality, with either people getting very grumpy or people getting depressed. And so that may not work for all of the people who have, maybe a metabolic syndrome or some kind of insulin resistance. It is probably one of the most effective diets for weight loss for the people who are overweight most of the time. And that can be done well, or that can be done ugly. And you can be on a keto diet where you're not taking a lot of unhealthy fats and not taking a lot of unhealthy foods, like highly processed foods or like processed meat, which are carcinogens. I think for most of the people, most of the time, I want usually most of them on a Mediterranean diet. That's the one I recommend the most to most of my patients, but also without the garbage. So without refined grains, without processed grains, and without added sugars, which sometimes you think, oh, that's Mediterranean, but contains grains, contains whole grains, contains water. That's not the same as is water. If I say, listen, I want you to go home and I want you to drink 2 500 milliliter bottles, 1 liter a day of water, and you go home and you drink 1 liter a day of whiskey, and you say, well, whiskey contains water, yeah, that's not going to work. So I don't know if I know what's the best diet for everyone, and I think that the best diet for each individual person is going to vary, largely depending on their needs. You need to do something and then monitor the outcome. You need to see how you feel. You need to see how your brain operates. Your brain is unique, and you're the brain operator. So it's not exclusively data-driven. It's not exactly possible to say this is the best, period. There are people who say that, and you'll see a lot of people on YouTube, and they're like big advocates of this or that, and they're like, this is what everyone needs to be on, and I just, that's kind of hard to believe because of the variability in the way brains operate, the variability in the way that people respond to things. So that's not an answer to the question, but I hope that's somewhat brain-explained.